So appreciate all of you being here, and we've got some really good information to share with you this month. So I will go ahead and kick things off. My name is Jen Wisdahl. I'm a Chief Operating Officer at FASD United and handle policy along with my partner in crime, Board Chair Susan Shepard Carlson, who also chairs our policy committee, Chris Melfi, who works on policy alongside me, and then also all my colleagues at FASD United, from our affiliate network to our family navigation team, our media hub, and beyond. So thank you for taking an hour to join us. Before we get started, I just wanted to check in with Tom Donaldson and see if he had any updates for the organization that he would like to share.
Well, thank you, Jen. Maybe just more of a hello. Good to see everyone. How do you do? I hope you've had a good start to the year. I think the most important thing is that as I think of the year ahead, is that we see you. So we're looking forward to seeing you, not just here, but in person. I mean, of course, that means at the conference in Seattle, just coming up in a couple of months or so, at Impact Week here in DC in September. That would surely be great. We really look forward to that. And also at the new FASD United office. I'm not there today, but Chris is, and we're really thrilled. Just over the last handful of days, we've been moving in. Chris and the team are getting things set up, and we surely hope to welcome you when you're in town for big events in the fall or any reason. I hope you'll come by, and so we're very excited about that. But good to see everyone. Thank you, Jan.
Thanks. And just a reminder, as Tom said, registration is open for the 9th International Research Conference on Adolescents and Adults with FASD. And really do hope to see you all there. We've got quite a few people coming. Registrations have been on the rise in the last month. Just a reminder that the early bird deadline is February 14th. So if you're planning on registering and you want to get as a professional and you want to get the reduced rate, really recommend that you get on that, and also make sure that you're able to book your hotel at the conference hotel. This conference is just a really good opportunity to A, connect with community, B, get policymakers and stakeholders involved in the cause, C, this is a Nothing About Us Without Us event. The ALC FASD Changemakers have created a track and sessions specifically for adults and teens with FASD that they can participate in and enjoy and get together and come together as a community, as well as some of the most preeminent researchers from around the world. There's an email coming out today with an added session. So we're even adding sessions at this point, and there's a great pre-conference session on FASD and the law that is really coming together to be something fantastic. So just encourage you to check it out, and really hope to see a lot of you there. So this year, we're really focused on giving FASD a seat at the table. And that doesn't mean that we're out there screaming and yelling, give FASD a seat at the table. Not that we don't want to do that from time to time, but what we're doing is making people aware that in places where conversations are being had, such as in policy, healthcare, maternal child health, things like that, FASD needs to have a seat at that table. And how can we equip ourselves and others to help give FASD a seat at that table? So one big piece of this is the FASD Respect Act, and I don't know if there's anybody new on the call today, but just very quickly, I'll go over that. It is federal legislation introduced by Senators Klobuchar and Murkowski, and in the House by Representatives McCollum and Bacon. And what it would do is reauthorize the FASD Center for Excellence and bring funding to the states to build awareness, education, increase diagnostic capacity, and basically build state and tribal systems for FASD. So looking at all those existing silos, those existing pieces of infrastructure in states where we always say, yeah, but what are they doing about FASD? And giving them a mechanism and funding to be able to give FASD a seat at the table in those spaces. So we've done a lot of work, and by we, I mean the entire country. Anybody involved in FASD, we've had a lot of participation from all of you in getting the act to where it is at this point. Very exciting in December. We keep this little pathway to law graphic to see where we're going, and you can see there was a little bit of a backup in the junction there between June and November. And for the first time in 20 years, the bill is moved past the Senate Health, Education, Labor, and Pensions Committee, and is ready to be sent to the floor to be voted on. So that's pretty exciting. This is somewhere that we had hoped to be. And like I said, it's been over 20 years since FASD legislation has done this. And that's happened because of all of you. It's happened because of all of those emails that have been sent to a representative in Schenectady, New York, or Paducah, Paducah, Kentucky, or I'm probably getting the state wrong, sorry, but it's happening because of all those pieces of outreach, right? The more we reach out, the more we move. And so again, I just want to express some gratitude, a lot of gratitude for the numerous efforts that people have made in getting co-sponsors, in getting people to sign on to the letter of endorsement. This is how we get policy enacted in today's world. So, and it's working. So Susan, I'm going to have you go ahead and give these updates, which are kind of exciting movement.
Okay, yes, the ONDCP. Now, I didn't know what that was. I had asked Senator Klobuchar's staff person if she had any updates as to circling ahead the Support Reauthorization Act, which if you've been following along, our language is in this bill. And she told me that they're urging Congress to support that. And it's the White House Office of National Drug Control Policy. So, and there've been a lot of pressure on Congress to pass the Support Reauthorization Act. And if you follow, if you're a political junkie, or even if you're not and you're following what Congress is doing, they finally have they've agreed now. They have a continuing resolution. We're talking about 2024 appropriations. They have continuing resolutions, which was supposed to be by the end of September. Well, now they have deadlines in March. And I think what that's important, and they've also given the committees the numbers that they can deal with. So now Congress can focus on getting that done by those deadlines. And they almost have to if they're not going to do a full year continuing resolution. So the importance of that is once they do that, and maybe it'll happen before. I asked Ruth, do you think this would happen before the support reauthorization? Would it happen before or after, or don't we really know? And she first said after, and then she said, well, we don't really know for sure. So, but at least it's something that, we're seeing that they have deadlines and they have numbers. And they also, I said this to, if you want to follow what's going on in Congress, you can sign up for Politico, and the House is taking up this major tax bill that increases the child care tax credit, and it's a bipartisan bill, and it'll take both Republicans, Democrats, and they're going to be voting on that tonight. And I think in the Senate, it looks like that's going to pass, which in an election year, to have a big tax bill like that pass, I think bodes well for everything else is going on. So that's how we kind of, I think, gauge there's a lot of partisanship going on, and you see that, but at least there's this big bipartisan tax bill that's coming up. Jen, I don't know if you want to add anything to those.
Well, I think it helps to keep an eye on these things, because then we know specifically when to step in and give a flag. Hey, let's make sure we push this in, or hey, let's see if there's an opportunity to connect our bill language. Because again, the Support Reauthorization Act is what we call a vehicle bill, right? So it's a larger package bill that our bill has gotten put into. And the good news is it really is seen as a must-pass bill. And if they are passing other bills, that bodes well for the Support Reauthorization Act. But the other good news is that, let's say for whatever reason, the Support Reauthorization Bill does not get passed, we have other opportunities to pass our bill. It's not a one and done situation. And that goes through next year, or well, goes through this year. So we have till December to get our bill passed before we have to start over again. And we're in good shape. We're in much better shape than we were the year before, and we almost got it done. So that's why we're kind of talking about these other pieces, because it really does have an impact on where we are. So what's happened in January? Well, Texas has been on fire. Really appreciate the outreach that the group from the Texas FASD network has been doing, and a big shout out to them for getting a lot of meetings in January, a time where we typically don't have a bunch of them. And then also to Georgia, meeting with Representative McMath. And I know that was a big, it took a while to get those meetings set up. And so, but those meetings that we have with our legislators, even if we've had them before, if you've had one meeting with your legislator, have another. If you've had 2 meetings with your legislator, have another. If you've had 3 meetings with your legislator, have another. We have to keep this top of mind, and it really does make a difference the number of times we connect with them. It's not a one and done situation. A couple of other great new co-sponsors. And I wanted to point out one in particular, Representative Stansbury, who came on board from the great state of New Mexico. I don't think we've had a sponsor from New Mexico before, but we were able to utilize some of our CFASD researchers there. And this is another kind of opportunity that we're working on at FASD United, because we are members of the Collaborative Initiative on FASD, which is a group of researchers working on FASD related items. They can't lobby. They can't ask for policy change, but what they can do is provide education to their lawmakers. So we're working and going to be increasingly reaching out to the CFASD researchers and getting them involved in educating our lawmakers and their legislative assistants while we or constituents make the ask. So really trying to expand our web there in terms of getting people on board. We're up to 48 co-sponsors in the House, 11 in the Senate. And if we looked at the end of December, we were at 45 co-sponsors in the House. 44 co-sponsors in the House, and 10 in the Senate. And last legislative session, when we almost got it passed, we were at 74 and 10. So, and it took us 2 years to get to that point. So in 1 year, we were at 45 and 10. So if we work just as hard this year as we did last year, we can definitely, be in the 80s or even 90s in terms of co-sponsors in the House, and definitely more in the Senate. And each one of those co-sponsors really helps to bring credibility to the bill. That brings political weight to the bill, political will to the bill. So I can't, I mean, I know I sound like a broken record. Oh my gosh, have your meetings with your 2 senators and your rep, but it really is the thing that is keeping us moving forward. And I just encourage you to continue that. And if you haven't done it already, reach out to Chris. If Chris, you can throw your email address in the chat and get started on it. And you know, he can help you, I can help you. We'll be there right alongside you. But we definitely this is the way it's done. So looking at co-sponsors and meeting, you can kind of see the areas of coverage and the areas where we might need a little bit more help. And again, if you notice there's areas in the Senate where you have had meetings and they're not noted here, please email Chris. He'll get that corrected. But you know, we're getting some good coverage there. But definitely we want to do more. There's a question in the chat about how long is a reasonable amount of time between meetings with your legislators. I would say give it a month, maybe 2, but month is good. You can just we can give them an update. We can let them know of other organizations in your state that may have supported or endorsed the FASD Respect Act. Carl has a good tip on reaching out to candidates who are running for election in the House and Senate. They tend to be a lot more responsive when they're running for office. So that's a good way to proceed there.
It's never too soon to start educating.
Very true.
And I have to say, I think when it's an election year, you're going to find your members are going to be more responsive, I think. So I could go both. You could, you know, take that too.
Absolutely. So our House co-sponsors and meeting, just looking at the, you know, the coverage of the map. And gosh, wouldn't it be cool if that entire map was yellow? And even better if that entire map was blue. But there is, you know, there's a lot of, in some of the things you don't see is like in California, some of the districts in California are so small, you can't even really see them on the map, but there's a bunch of blue colored in there and a bunch of yellow colored in there. Same thing with Texas. There's some very small, densely populated areas that you don't necessarily see there, but there's been a lot of work done. And again, this is what's moving us forward. So we've got some new resources to share with you today. We've got a sample template that is legislative language for a state FASD advisory committee. And that is something that would be helpful to have in place even if the FASD Respect Act doesn't pass. But when the FASD Respect Act does pass, it will also be very helpful and critical for your state to be able to access funding that's authorized by the FASD Respect Act. We also have, in case your path seems better to go through the governor, we have a template for an executive order for creating a state FASD advisory committee. And so we're going to share those with you. I'm going to walk through them and kind of how they work. We'll have those up on the website by Friday, along with a copy of this this presentation and some other guidance on how to put these together.
So Jen, I just noticed the legislation goes beyond just the advisory committee. It also creates a state FASD program. So
yes.
we'll see that when we,
yeah.
See, it's broader.
Bear with me half a second while I swap documents. So in specific here, I'm going to pull up the draft statute to share now and kind of show you how these documents work. Let's see. Can I get a thumbs up or a hands up if you can see it? All good? Okay, cool. So what we have here is the way this is written is the way a law is written, right? So the format is actually important. So that's a number one thing to remember with the line items here. Anywhere there are the brackets where it says statute amended or where it says name of state, those are areas where you need to fill in some additional information, right?
So, and I
So-
just need to do a disclaimer, I'm not a legislative drafter, and so the sections, I mean, this would have to go to a reviser in your state legislature to put it in exactly proper form, but I mean, so the language, the template language is there, so I just want to do a disclaimer on that.
But and some of that comes about too because every state is different in how they do legislation and what they required.
Yeah.
And Carl, if you want to send that legislation that you have along too, we can include it on the page. So that way it's all in one spot. But what this bill would do, and correct me if pop in Susan, it would designate a state coordinator. And we put in there specifically, and this is an area where if you have a legislative champion, they might change this, with knowledge and experience in the field of prenatal alcohol exposure and FASD. Because if you have a state coordinator who maybe doesn't have that experience, they're going to have a big learning curve before they're ever able to really help and support how FASD is handled in your state. It would allow them to utilize and adapt the federal and state programs and include FASD and FASD support in those programs. Develop and expand screening and diagnostic capacity. Who doesn't want that? Looking at intervention, looking at awareness, and then training for professionals across sectors. Sorry, go ahead, Susan.
Well, and this is permissive, and that's one thing you learn with legislative drafting, that legislators they want to provide flexibility. So these are all permissive, and it's not limited to that, but it gives them good guidance as to what would a good FASD state program do.
So there's a definition section on FASD, and it includes all the different umbrella terms under the FASD umbrella, including, and I wanted to point this out because it sometimes gets forgotten, the static encephalopathy alcohol exposed. Those of you who are in Washington State, if you know, you know. That's a diagnosis that's given under the Washington State 4-digit code. And so sometimes it's not included, but we made sure to include it here. So if your state doesn't use that or your diagnostic clinic in the state doesn't use that, that's fine, but we did put it here for the purposes of demonstration. Lead agency, and this is where you'll want to work with your legislative champions. What agency in the state is best equipped to handle a program like this? Where might it be housed? And they may change this this section to allow one to be appointed as opposed to designated. But this is where doing that homework in advance and figuring out who the lead agency should be makes a lot of sense.
Well, and I do have to pipe in here, Jen, because when we did this in Minnesota, there was we had a health Department of Health, and we had a Department of Human Services, and it could have gone to either one. And then what ended up doing, it went to health, which actually was smarter because the programs in health were not necessarily, they were more protected than the Department of Human Services. So there actually was some funding that went to Human Services, and it got, a lot of times with the legislature, they'll eat up things, and they'll take money from one thing and put it to another. So it seemed like in our instance in Minnesota, the health department was a better agency. So, and that's that was something that I learned. I didn't know that, but learned that in talking to people from the administration and the legislature. And that can vary, you know, that can vary by state.
So the next part is the state advisory committee. And again, anywhere you have these brackets with, you'll want to look at
Well,
creating some language.
that's just telling the purpose
Yeah.
yeah, so
But
that,
with the upper
The agent-
cases, sorry.
yeah,
Yeah.
yeah,
Yeah.
yeah. That might be a little-
And again, if you have a legislative champion, they're going to guide you through this. They're going to appreciate that you're bringing this to them, and they will make adjustments and changes. This happens all the time. You know, we went back and forth with our authors and our lead sponsors on the FASD Respect Act. So even if you provide them with this, it's going to go through some changes and amendments and before it even gets introduced. But it would, you know, we're developing a strategic state plan. Who wouldn't like a strategic state plan in their state for how you're going to support FASD and have it, you know, not, this is permissive language, not limited to include strategic plan, guidance on implementation of the plan, and then making recommendations for how state agency programs can be used to execute that plan. But having a state plan for substantially reducing prenatal alcohol exposure, providing for the identification, treatment, and support of people with FASD and their families, like, that's something that we want. So looking at composition, and again, because this here is not in all caps, you would leave that there. All caps means we change it, and we'll provide that guidance on the website too. But it gives us the numbers of who's, you know, who's going to be on that committee, what stakeholders should be there. And then, and it might be appointed by the governor, or it might be appointed by somebody else. You know, your legislative champion can support you with that. But just talking about how that committee would work. And then this goes into having an FASD state coordinator, right? And how they would support the work of that committee and the creation of the state task force. I know this is riveting reading. So once we have it up on the website, I'm sure everybody's going to be downloading it immediately and using it as your bedtime reading. But I just wanted to kind of highlight again what this is doing in a nutshell. The other piece on this, so the FASD state coordinator is the person at the state level who's actually making this all happen, right? Because if you didn't have that, you'd have a mandate for this committee, but who's going to make it happen? That can get lost, and then you know, unfortunately, something might not happen. So then also reporting out, you know, they need to be reporting out on the activities of the committee. What are they doing? How are they doing it? You know, there needs to be some accountability for this committee for what they're doing in the state. And again, these information might, you know, the information in here might change based on what your state's policies are, but we wanted to make sure that piece was in there. So that's the statute.
Did you have
any- the governors?
the appropriations at the end? I didn't see that.
No, you didn't have the appropriations at the end of that one.
It was in what I sent out. So I wonder if we lost a page. Well, yeah, there
Okay.
was,
Well, do you want to talk about that, Susan? Because I can go back and.
well,
make
there
sure
was a
it's in there.
section on, because, you know, this is to, you know, get you a conversation with the state, you know, your champions. And, you know, nothing prevents them from doing an appropriation to get this started. And so there was an appropriations section And, you know, maybe they could put something in there that this is effective upon, you know, the Respect Act. But yeah, there was another, we'll make sure that that's on the webpage. We'll review it. And if you have any, you know, if you have any questions about any of this, you know, you can put them in the chat now, or we tried to make it as general. I mean, the more specific you make it, you know, the less it's going to be applicable. So it's, you know, putting exactly who you want in it. So it's general in, you know, who's going to be on the advisory committee and the number. That's all. You know, that those are the decisions that you can have discussions with your legislators.
All right, and it looks
Okay.
like NCFASD Informed is already working on this, which is great. So yeah, these are things we definitely you know, want to be working on now. This is a now opportunity. Let me go back to my slideshow. Sorry.
Good. And then, yeah, the next one's an executive order, and I didn't create this. Well, I did. You always try to find somebody who's done something, and back in beginning of 2000, there was funding that went for a four-state consortium with Minnesota, North and South Dakota, and Montana, and the governor did an executive order creating an advisory committee. Are you gonna? And so and that was, you can just Google it, and I did, and I found it, and so we use that as a template. Do you have that one, Jen?
The governor's one? Yep, I will
Yeah.
pull that up now.
Yeah.
All right, everybody seeing that? And I noticed before we go, Liz has her hand up, and then once Liz is done, Kathy had her hand up.
Okay.
Hi there. So if you're dealing in a state that has absolutely nothing like Virginia, this is a bit overwhelming, but my only question for today is, as I think over this, is do you have to have FASD defined in the code already in order for this to be done, or do you have to do that first? Or can this be that document?
This can be that document.
Okay.
Yeah. And if you've got it defined, which I would hazard a guess that very
It's
few.
not.
Yeah, it's not. Then this creates that.
Okay.
And so, yeah, so I think it's an important first step. And if you have a good relationship with your governor, this is a good way to get started with the advisory committee.
Sorry, just
Well, maybe after the election, you might have a good, I don't want to make any political, but, you know, not meeting with the governor, but with his health staff, you know, to share this with and talk about the Respect Act and, you know, because governors could do this. I mean, and they definitely could do this, you know, as soon as the Respect Act language is passed and before we know what the appropriation is going to be. But, and that's what happened with the four-state consortium money. That money was passed, and then and I didn't see one for the governor of Minnesota, who was, I guess at that time, Jesse, that did it. I think it just went through our health department, but I think this is really a good way to start getting the administration involved in and their Department of Health, because what they'll do is their health person will contact the health department, whatever department, you know, they think it, you know, where it should go and who should comment on. That's what they'll do when you have that discussion.
Hey, Kathy Hotelling, you had your hand up, and then I know Sid, you have your hand up as well. I just want to acknowledge that. Kathy?
Yes, sorry. Okay, Susan, I missed something you said a few paragraphs back. You said something about dependent on the passage of the FASD Respect Act? Are you suggesting that that be a caveat to the creation of this?
Well, I mean, I think that's discussion you have with your legislature. You know, they can start, you know, if they want to fund it before the Respect Act, they could start this process. Or, you know, and maybe there's a way that they can pass it and have it contingent on getting funds from the Respect Act. I mean, I think those are the discussions that you have with the legislature, and they'll, you know, and they'll send it to they'll make a decision and send it to their revisor for the appropriate language.
Right. Yeah, that's what I thought. I guess, I mean,
Yeah.
I know it's gonna pass, but just in case it doesn't pass this year, we need this advisory committee anyway, period.
Right.
I mean, everybody else under the sun has one. Not quite, but you know what I mean. Especially
Yeah.
in North Carolina, we have autism, we have TBI, we have this, we have that.
Yeah.
There needs to be an FASD one, so I hate to make it contingent on the Respect Act because we're, you know.
Yeah,
we
no,
lose
I
half
would
the
go,
country.
yeah, no, you're absolutely right, and I wouldn't ask that it be
Yeah,
contingent.
sorry,
But-
I'm moving back and forth because I have a dog wrestling with me. I'll
Oh,
turn
yeah,
off.
yeah, I
my-
understand. Yeah, I mean,
Usually
that's
it's a cat.
that's kind of a fallback position, I think. You know, if they're resistant to going ahead and doing that, something on their own. And maybe they wouldn't do it, if, you know, maybe they wouldn't do something that's contingent on the Respect Act. It's too iffy, but
Okay, thank you.
yeah, hope that helps.
Thanks, Kathy. Sid, you have your hand up, and then Marilyn.
It's a longer discussion, but I wanted to insert a note on the idea of the lead agency. It's sometimes important to make sure that a responsibility that is by definition interagency not get stuck and buried in a single agency. The health agency matters, obviously, but so does child welfare and the court system and criminal justice and juvenile justice and developmental disabilities. And if those players are left out of the game, or allowed to send third level people to a meeting that takes the place of serious action, you're not going to get that much done. So you may want to be very careful in making sure the lead agency has partners at the right level, and that you've thought about all the different parts of state government that are potentially involved in prevention and response to FASD. It's not just a health issue.
Yeah, no, yeah, and Sid, you're absolutely correct. And when we did our FASD coordinating board, we had all that language in there. But what needs to happen, I'm talking more of a fiscal agent. You have to have a lead agency that's a fiscal agent that's gonna do the funds. You can't have, and I didn't want to get in, I mean, if you look at and I don't know if it's on this, yeah, I mean, scroll down, Jen. The advisory committee, and it's, like I said, it's very general, and these are the kind of the discussions, that composition. So council, yeah, we got to change that to committee. And so you can be more specific in this section on the composition of the advisory council, but you have to have one agency that has fiscal control over it, because they're gonna and so you got, you know, limited representing health and maybe state agencies. So this is just to get the discussion started, and you can pull in whatever other agencies that are going to be part of that advisory committee. This isn't, and so it's going to be an advisory committee. It's not going to be just an interagency. It's going to be a broader advisory committee. But you know, you're absolutely right. I mean, we know what happens with the federal government. You got all this bureaucracy. Well, you have the same thing on the state. But our FASD coordinating board really was a good example on an interagency coordinating board. And it had the top level members from those agencies as part of it. But I think that's a very good point. But you
I
have to
think-
have, but you have to have that lead agency to, you know, submit the request for proposal for the, you know.
I think too, this section can really be thought about based on the relationships you have in the state, and really think through how you want to word this piece, because Sid's spot on. If you have a committee that's made up of junior tier, lower level, kind of there just because they have to be there, not because they have the power to actually do anything, this isn't accomplishing what you want it to do. So this would be where really talking to your champions too, and having those relationships built with the different stakeholders and agencies before you look at putting this together. That way you're not walking in blind. California and Sid and the group at FASD now have really done a great job of going through and trying to build those relationships with the different agencies. And that's what's going to need to happen on a state level to get something like this to work. So really appreciate you bringing up that comment, Sid.
Yeah.
Marilyn, you had a question.
Am I showing up? I can't see myself.
Yeah,
But
yeah, you are.
okay. This brings to mind, I did a presentation with someone else about FASD in an adoption setting with a lot of adoptive parents. And I had offered to do it the next year again. And they said, well, we want it to be on neurodiversity.
Mhm.
So, which we're not even sure that we'd have a seat at that table. If you've heard people talk about neurodiversity, it's often leaves FASD out. How specific is this that this has to go towards things related to FASD, not to autism, not to other neurodiversity efforts?
Well, the way these samples, these templates are written, it is specific to FASD. That's really, whether this goes to neurodiversity or whether this goes to other developmental disabilities, that's really up to you and your state, how that might come to pass, and the relationships you're building with your state to do that. I think in some areas and in some ways that might be beneficial if FASD is included, specifically named in a neurodiversity task force. In other cases, it might not be. It just really depends on how your state is defining that and how your state is using that. We always say we want the same kind of attention that autism gets, right? So if we're at that same table, that might be beneficial. But again, it really is state dependent, and writing something that is specifically applicable to each 50 state, each of the 50 states, given the fact that there are such differences, that's a little bit more challenging, but really good point. This goes back to needing to know who you're working with. So I appreciate you bringing that up, Marilyn.
Well, and
Well,
I'm also
I
thinking
think
about the money. The
well,
money
that's
is
what I was just gonna say, Marilyn. I think what Marilyn was getting at, and that will be, when the Respect Act passes and the authority is given to the HHS secretary to develop the request for proposal. There's guidance in the Respect Act that's says that they may include doing the FASD strategic plan and also a FASD state coordinator. So we didn't put it that the HHS secretary has to put that in, but it's strong. It's in the Respect Act language. So I would be surprised if it's not. So because I think we definitely wanted to have that language in the Respect Act, because I could see that funding, the Department of Health, oh, we're gonna do a prevention, use all that money to do a prevention campaign or neurodiversity or something, and put it in one of those silos in state government, rather than begin to, what the intent of this bill is to have them look systemically at those silos in state government, and how do we how do we factor FASD in there? It's not to just pick out another silo and put money into it. And so that's in the Respect Act. And so we're gonna be like, what's the word that we're gonna be right on top of that, with this, and putting in, so we make sure we're gonna put our, recommendation as to what needs to stay in any request for proposals for grant funding.
Yeah.
And so that's why these are written that way, that they're not, that'll give those states that actually go ahead and do this a leg up in getting funding.
And keep in mind too, these aren't a thou shalt. These are a you can, and please do adjust these to your specific state and how your state operates and what's important to your state and where your state is. So, some additional guidance we give on this really is that this is not an opportunity for one person to do it. Although, one person can move mountains. Hey, cool. I'm looking at you, Carl, in North Dakota. But really, this is an opportunity to create community within your state around this. So this is reaching out to multiple stakeholders. This is not, I recommend if you're not involved with your state affiliate, get involved with your state affiliate or get them involved. I really, look at how can you share the work, because this is a big lift to get this done. Definitely the templates need to be customized to your state, and that will be an evolving process. And you're really going to want to think through, like Sid mentioned, how is this going to happen in your state in a way that's actually going to be meaningful and not lip service? You don't want a newsletter bill, right? You don't want a bill that they put in the newsletter, oh, yay, everybody did this, and then nothing happens, right? That would be the worst. So putting that time and effort between it. The other thing we're asking, and this is not demanding, this is asking, is let us know if you're working on something like this so we can keep track. So that way, if we get requests from other people in your state about, hey, what's going on, we can direct them to you. If you have two groups working on the same thing in one state and neither of you know it, let's get you together. There's power in numbers. So shoot Chris a quick email or give him a phone call and let him know that that this is something that you're taking on and working on, and you would appreciate that if anybody else contacts, and that doesn't mean you own it, it doesn't mean you're the boss of it, it doesn't mean dibs, I claimed it. What that means is that anybody in your state can work on this, but let's put you in contact with each other. Let's connect you so that you're doing it together whenever possible, as opposed to, two separate tracks. And yeah, the other piece that's really important is start now. This is not something to wait on. This is going to take longer than you think it will. And building those relationships is going to be the biggest piece of it. You can sit and look at the language all day and write the most perfect bill known. But unless you have those relationships built and you're prepared to and are already doing the outreach, your chances aren't great. So you need to have a plan for right? Having a great bill and having a legislative champion and having a coalition of grassroots supporters and having a plan for how you're going to build those relationships within your state and local agencies. Excuse me. So what can you do now? We want to continue asking for co-sponsors for the FASD Respect Act. And again, I know you've heard this over and over and over, but it really is going to it really is going to help. Like if we can get when we get the Respect Act passed, it's going to help the state legislation and vice versa, right? Again, doing your homework. And we kind of talked about this a little bit last month. You know, what state agency might be best to house the FASD program? Who's the contact? Who would you be talking to? Are there multiple state agencies that you want them to jointly house the state FASD program? Great. Who are the contacts? Have you met with them? Do they know what FASD is? Right? Are they engaged? And then having a plan and having something written, a spreadsheet of who you're contacting, a database of who you're contacting and who's contacting them and when. Being organized on this. This isn't just a kind of, I'm going to pick up the phone and call somebody and have that conversation, and it's going to feel really awkward, but I'm going to feel great when I'm done, and then I don't know what I'm doing after it. That doesn't work. You need to have a plan, right? So a strategic plan for how you're going to do this. And then also find your champions, find legislative champions, preferably from different political parties. You know, who is most closely aligned to this cause? You know, do they focus on foster care? Do they focus on criminal justice? Do they focus on substance use? Do they, you know, are they a parent of a child with a disability? Are they a person with a disability themselves? Find some alignments. Are they on committees that you might need to get these bills through? Those are the people you want to connect with, foster, build those relationships in addition to your governor's office, and create and document those relationships so that you can work on this bill, just not on your own, but also in partnership and in tandem with the legislator's office, because that's going to make all the difference there too. I noticed that there's a comment on the website about when will the template be, or comment in the chat, when will the template be available on the website? I'm going to try and have it up there before Friday, but I will commit to Friday. We'll have it up by Friday there. And then on Tuesday, you will get, as you do every Tuesday, if you're signed up for policy updates, you'll get an email out just as a reminder that it's there, right? So anything we update on the website, you get a reminder email on Tuesday. Another thing I wanted to just put out there is that if you are already working with state agencies, already talking to state agencies, you know, sometimes it's the plucky group of grassroots supporters, you know, parents, caregivers, people with FASD that are turning the tide, but sometimes having something that is like, you know, official and larger can help push them over the edge. And so I would say, if you're working with people on a state level, make sure they know about the conference. Get them there. If you can get them in a room for 4 days where everybody's eat, breathe, sleeping FASD, that's going to help. If you can get somebody from your health department, from your child welfare, from your juvenile justice, you know, any of these areas into a space where FASD is the focus, it's certainly not going to hurt. So I just wanted to put that out there, not as a plug for the conference, but to use it as a tool. There's a strategic reason why we wanted to have the conference in the US. A, because it's a great conference and I'm excited about it, but B, because this is a great mechanism to get people on board, to get lawmakers on board, to get agencies on board. So please use this opportunity to do that. All right. So thank you for being with us to work on giving FASD a seat at the table. If you have questions, as always, we're here to answer them as best we can. If we can't answer them, we'll see what we can do to find you an answer, or at least connect you with somebody who will know. And just appreciate you taking an hour out of your day to do this. So on that note, I'm sure our website will be flooded on Friday with people downloading the documents, and I'll make sure that the appropriations piece is in there. The other really quick thing is just keep an eye on your legislators' websites, see if they've got town halls, meetings coming up, anything that they're announcing federally that you might be interested in. There's a lot happening now that I think we can get some of the budget stuff out of the way. So it's a good time to keep an eye out there. So,
Well, and Jen, I want to say the last 2 weeks of February, they're not in session, so they'll be in district. So that might be a good opportunity to do a little advocating.
absolutely. Carl, you had your hand up?
Yes, I just wanted to add, in April, every state has its own developmental disability council of some kind. And in April, a lot of those directors are going to be in DC for Hill Week, for their Hill Week. So you might consider reaching out to your developmental disability council and talk to them about FASD if you're not already doing so. Just as an FYI.
Absolutely. That's a great suggestion, Carl. Thank you. I know you chatted me with that earlier, and I appreciate you remembering.
Is
So,
that state, Carl, the state level?
Yes, every state in the country, and all of the possessions and, whatever you call it, like Puerto Rico has a developmental disability council of some kind, mandated by federal law. So, they're sending a lot of their directors to DC in April for Hill Week. I know because I found that out because I invited our state's director to Washington DC, or to Washington State with us for the conference, FASD conference. So and she said I can't go because we're, going to DC for Hill Week. So yeah, our state actually made FASD its 5-year plan, and we're on year 2 of that. So they're very aware of the issue and where we're at in North Dakota with that. So definitely reach out to their offices and see if maybe they can help you get the word out to your legislators.
Hey, Jen, can I just ask one more question? So I'm just thinking about the following up with this, my 2 senators that I met with in December, they both said their legislative aides said they would not, they would support the thing when it came to the vote, but they would not be, they for some reason, they see this co-sponsoring thing is like a hill they don't want to go to for this one. So if they say that, then does that mean do you just let them go, or do you still follow up with them asking for more meetings?
I would still follow up with them. I would look and see if they co-sponsor any bills, right? And if they
Oh
haven't
yeah,
co-sponsored
I've
us,
already, I pointed out to them that they're co-sponsoring bills that overlap, lap in terms of the health things with this, and yeah, okay, all right. I just wanted to make sure that what the strategy was there. Thank you.
yeah, no problem. No problem at all. Any other questions? Thanks for joining us, Michael. All right, well, thank you again. And we've hit the top of
Fingers
the hour.
crossed, everybody. We'll have maybe good news next month or the following month.